Tonight on Cox Forum.
Anybody who's watched a loved one progress through the stages of Alzheimer's knows that it's a very difficult experience. Here in Orange County, UCI Mind is trying to find a cure for Alzheimer's and other forms of dementia. We're going to tell you what they have found out coming up right now on Cox Forum. Welcome to Cox Forum. Our guests during this first segment, Dr. Frank LaFerla. He is the director of the UCI Institute of Memory, Impairments, and Neurological Disorders, better known as UCI Mind. Welcome to the show tonight.
Thank you.
Also with us, William Edwards. He is all too familiar, as he has said. He knows far too much about Alzheimer's because he has watched his wife as she has progressed through the stages of Alzheimer's. We're going to hear their story tonight as well. First of all, very simply, Dr. LaFerla, what is Alzheimer's? Is there something peculiar or particular about Alzheimer's that differentiates that from other forms of neurological disorders?
Yes, so Alzheimer's disease is a specific disease that attacks the brain, and that the most important symptom is the loss of memory. What's unique about the loss of memory that happens in Alzheimer's disease, at least during the beginning stages, is that patients remember things that happened to them in their distant past, but forget their most recent memories. So the way I like to describe how that happens is that they might forget the names of their grandkids, but will remember the names of their brothers and sisters.
Mm-hmm. What do we know now that maybe we didn't know 5 years ago about Alzheimer's?
So I think we now know that Alzheimer's disease is a continuum, and that it probably starts well before you get a diagnosis of the disease, probably as much as 1 or 2 decades before. And we know that there's a precursor form of Alzheimer's disease that's referred to as mild cognitive impairment, and that a significant proportion, about 50% of people who receive that diagnosis of mild cognitive impairment will go on to develop full-blown Alzheimer's disease within about 4 years.
Bill, tell us a little bit about your story. And you know, your wife was diagnosed at a fairly young age.
She was diagnosed in her early 50s. She actually was a geriatric practitioner.
Mm-hmm. Little irony there.
And knew, we're sure that she knew what was happening before we did.
Yeah.
We didn't really understand how this person was declining in ability to keep track of things, to know people. She was a very efficient person, got a lot of things done, and all of a sudden that sort of stopped.
Well, when did you first notice? And how much before the actual diagnosis did you start to suspect something was going on?
A couple of years. Now I've gone back and I can see that it probably was as many as 5 years before, but about 2 or 3 years before. And I knew there was something wrong, and it was very difficult to get her to admit it, even though she knew exactly what was going on.
Oh, really? And that must have been very scary for her, though.
Oh, for her it must have been horrible, yes.
Yeah. Now, is that, and obviously, as we mentioned, this was a fairly young diagnosis, but in terms of sort of the progression, is that a fairly normal sort of?
It's not unheard of for someone to get the disease that early in life. It's generally pretty rare. Those kind of cases we refer to as early onset, which is defined as any cases that begin before the age of 65. Most Alzheimer's cases begin what we describe as late onset after age 65. And age is certainly the most significant risk factor for the disease. So it turns out that 5% of the population over 65 is afflicted, and that number doubles every 5 years. So if we do the math, that means 1 out of every 20 people over 65 have the disease, 1 out of every 10 people over the age of 70, 1 out of every 5 people over the age of 75, and 1 out of every 2 to 3 people over the age of 80 to 85. And so essentially half of the population over 85 suffers from the disease.
So extrapolate that out. How many people does that mean here in Orange County?
So in Orange County, we estimate that there are about 75,000 people right now that are afflicted with Alzheimer's disease. Over the next 15 years or so, Orange County is going to be essentially tied with San Diego County for the dubious honor of being ranked second in the state in terms of having the most number of dementia, Alzheimer's cases. LA County will be first, and Orange County and San Diego will have about 92,000 cases each.
Wow. Bill, talk about, you know, you obviously, you said that it took a couple of years before you figured out what was going on. Was it just hard to find somebody to make that diagnosis? Is it?
It's very hard to find because typically your family doctor doesn't really know what this is all about because that's not their specialty. And we were very lucky because we were, I was actually getting executive medicals every year, physicals every year at UCI, and decided that I was going to actually trick my wife into going to get a physical, knowing that she couldn't really do all the motor skills and that sort of thing. And sure enough, that was when she finally admitted to the doctor that's the head of the executive healthcare group that there was a problem. And then we were referred down into what's now UCI Mind, 'cause it's been a while since this happened. And we went through all the testing, extensive testing, to determine exactly where we were in the disease and which type of Alzheimer's, which type of dementia there was, and what was the best path to prolong a good quality of life.
Okay, doctor, if this is so prevalent, why is it so hard to find a doctor who can recognize what's going on?
I think a lot of people get confused and they tend to lump all of these disorders as just being a dementia, and they stop the diagnosis at that point. They really don't probe further to distinguish what type of dementia it is. And the way I like to describe it is dementia is a broad umbrella term in much the same way that cancer is a broad umbrella term. And if you tell someone that you have dementia without determining what type of disease that has, it's like someone telling you you have cancer without telling you whether or not you have skin cancer or lung cancer. And you could easily imagine that if someone had breast cancer, they wouldn't want a drug that was used to treat prostate cancer necessarily. And the same thing applies for the dementias. There are many types of dementias. Alzheimer's disease is the most common type, but it's not the only type. There are other types such as vascular dementia, Lewy body dementia, frontotemporal dementia. Some patients with Alzheimer's disease will have a touch of Parkinson's disease. Likewise, some Parkinson's disease patients will also go on to develop dementia. So understanding what type of dementia you have is critical for making sure that you get the best possible care. Not the least of which is because some of the drugs that are useful for one type of dementia could be quite detrimental for another.
One of the things that you have done is to create a foundation in the name of your wife. Talk about that foundation. What you do.
Well, we have a tremendous amount of friends. We've been lucky to live all over the world, and we have friends all over the world, and business associates for myself. And everybody, when they found out Nancy had this disease, was wondering how they could help. What could they do? And there's a lot of discussion about Alzheimer's out there, but there's not a lot of focus about where things are being done, not necessarily to find a vaccine, but just, as we found over the years, to prolong a good quality of life. So you have time, okay? And so I decided, my wife, myself and my daughters decided to form a foundation that would focus any money that came into us into this type of organization, because we found that they fine-tuned the medication Nancy got, and it really did prolong the time when she was fully with us. And that's one of the things I know the doctors group is working on, is that we need to find a vaccine. You know, I have a 32-year-old daughter that I want you to find that vaccine before she gets old enough. But if someone gets it, the idea of prolonging the good quality of life before they decline is so important and so powerful to us. And we've been very lucky that so many people have now have given money to our foundation, which goes directly to one place. We're really sort of funneling it. You know, there's lots of different places that are doing research, but we have a personal experience here that everybody knows about, and we would think that's pretty important.
What's your website?
It's called nancyslegacy.org.
Very good.
nancyslegacy.org.
And your website?
mind.uci.edu.
Thanks both for being with us. When we come back, we're going to be hearing about how you can also help support UCI Mind and some of the things they're doing there. Don't go away.